Hi, today we're going to discuss vitamin D. Vitamin D is also sometimes referred to as the sunshine vitamin. The reason is, in your skin, there's a lipid called 7-dehydrocholesterol. Your skin has this incredible ability when it comes in contact with the sun to change that and transform it into cholecalciferol, which is also known as vitamin D. We can also get vitamin D from our food. So why do we need vitamin D? Firstly, for our calcium metabolism. Vitamin D helps absorption of calcium and phosphate from your gut. And it also regulates how much of your bone gets broken down so that that calcium from your bone gets absorbed into your bloodstream again. For people with a vitamin D and calcium deficiency, it can lead to osteomalacia, and in children it's called rickets. Another big reason why we need vitamin D is for our immune system. Vitamin D helps us to fight inflammation. Now, during this COVID pandemic, there's been fascinating studies showing how detrimental vitamin D deficiency can be and how important it is to have adequate vitamin D levels. Another reason is for dental oral health. Vitamin D has been linked to help the anti-inflammatory and antimicrobial factors in your mouth to help fight tooth decay. We need vitamin D for our blood pressure. It's been shown that if your vitamin D is just low for a couple of months to a year, it can greatly affect your blood pressure. And then if your blood pressure is high for a period of time, that can lead to organ damage. Vitamin D is essential for weight management. There's been links between obesity and vitamin deficiency. Vitamin D is also important for our mood. There's been studies that have shown a link between depression and vitamin D deficiency. Then vitamin D has cancer-fighting properties. The reason why some people are vitamin D deficient is if they don't get enough from their food and they don't get into the sun. I grew up in South Africa. I practiced medicine in South Africa, and it was very uncommon to see people with vitamin D deficiency. Whereas here in Canada, I see it very, very commonly that people have low vitamin D levels, whether it's in my family practice or when I admit patients to hospital. I quite often check their vitamin D levels, especially patients with osteoporosis or with heart disease or some type of leaky gut where they can't absorb vitamin D as well. What do we do if we find that vitamin D levels are low? First, in hospital, I give medication and supplement it. But what you can do at home is to increase your vitamin D intake from foods. Foods that are rich in vitamin D are swordfish, rainbow trout, tuna, mushrooms, egg yolks, salmon, and cod liver oil. Then there's many foods that are fortified with calcium. So in Canada, it's mandated that all our milk products and milk substitutes get fortified with vitamin D. So it's important to notice that milk doesn't naturally have any vitamin D. We just add vitamin D to it before it gets sold to the consumer. And then substitutes such as soy milk, almond milk, all of those, and infant formula has to be fortified with vitamin D. Our Canadian guidelines are to still take a vitamin D supplement every day. It's 1,000 units per adult and 600 units for children. I have 3 children and all 3 of them has been on a vitamin D supplement from day one. When you're breastfeeding, you can actually put a drop of 600 units onto your breast when you breastfeed baby. And then as they get older, there's gummies and very easily. I know kids are fussy to take medication, but usually the vitamin D gummies I found with my kids work quite well. Vitamin D doesn't get excreted in the urine. the same way as other vitamins. It's a fat-soluble vitamin D, so we don't want to get in too much of vitamin D. However, if we stay with our Canadian guidelines of 1,000 units a day, we'll be good. And as always, consult your own doctor.